Good afternoon, everyone. My name is Ammar Kaldum, coming to you live from the first day of the 21st Emirates Critical Care Conference. Sitting beside me is Dr. Hussain Al Rahma, founding chairperson of the conference. How are you, Dr. Hussain?
Fine, thank you, Ammar. It's my pleasure also to be online with you, so that we can chit chat and speak about the Emirates Critical Care
It's a
Conference. Yeah.
pleasure to have you, Doctor. Now, for those who don't know you, can you talk a bit about your background, your educational background, your professional background?
My name is Dr. Hussain Al Rahma. Basically, I'm a local from Dubai. Did my MBBS, or let's say basic medicine, in Pakistan. Then I went for post graduation in Germany. I came back to Dubai in 1997, fully certified critical care consultant, where I started my work directly in the DHA Rashid Hospital as a leader and head of department of the critical care. We established the first intensive care unit in Rashid Hospital, starting from the beginning exactly of 1998, and we could finalize it fully independent critical care services in Rashid Hospital. At the same time, parallel, Dubai Hospital was running the same program. 2002, we established then the Department of Emergency and Critical Care, and where we could grow through the time in establishing emergency and critical care services in the DHA, expanding on all the hospitals. From then, there we started on or thought about going on to establish the education and the training so that we can achieve this same concept through all hospitals in Dubai and then UAE, of course.
And what inspired you to create ECC? And what sets it apart from other conferences discussing the same topics?
There's a beautiful story, actually, and then there is a vision. The beautiful story that we were five Arab doctors attending the European Society of Critical Care Medicine, and we have seen a very huge conference there that was talking about critical care. And we have seen people coming from around the globe. So the idea came, why not in Arab world? And why we do not establish such service in the Arab world, especially those days UAE has established service, Saudi Arabia established the service, Egypt started the service, Kuwait established the service. And from there the point came. So as long as I came back to Dubai, I negotiated the idea with the DHA, and they welcomed it. And they, to be frank with you, supported us fully. Where our first step to establish a critical care conference in 2004. We were having a full support from the Dubai government. As you know, Dubai is trying to lead all over. So the vision was to really make the medical field advance. And since we were talking about subspecialty critical care medicine, which established all over the world since 1984 or 85, we said, well, let's start it. And the best way to start it is also to educate everybody else around. You cannot do it only alone. We have to establish the service throughout Dubai hospitals, throughout UAE hospitals. So that's where the idea came. The best way is to establish a conference. And that was the beginning of the ECC, Emirates Critical Care Conference, 2004. Yeah. Alaikum
Now,
salam.
now, what sets conferences apart from each other is the quality of the speakers, as other factors contribute. How do you choose speakers for a conference like this?
Now we are in the 21st number of the ECC. That means we are running this for the last 21 years. Since 4 years, the World Federation of Critical Care for Intensive and Critical Care Medicine labeled us ranking number one in Asia and Africa, and number 3 or 4 in the whole world, the globe. Now, ranking the conferences usually depends on the number of speakers attending, the number of lectures, the diversity of lectures, the number of workshops that are running, and the number of attendee at last, and the diversity. Now, if you go through all of the conferences running all over the world, subspecialized conferences like critical care, we have one in America, two in Europe, and the three of them are very specific to the Western countries. So what we went to establish something is more diversity, where we bring our motto from the beginning was that we bring the West to meet the East in Dubai as a hub, center of the world. And we could start with bringing professional speakers, professional researchers to attend and deliver their results, deliver their speeches, deliver their guidelines, protocols, new ideas, artificial intelligence, and so on in the in Dubai, so that people from the West or from the East can exchange. So if you are spending millions of dollars to establish a service, how come me in India or in Thailand or in Dubai, I can't establish the service at the same level with much less the cost? Why? Because I don't have the cost of starting it. I don't have the cost of establishing it. I have the cost of the end result of it. So that will be much less. And that's the concept of making things straight. Now, to reach that rank, of course, you have to have a choice in how to choose your speaker. So we have established committees. It was in the beginning regional, local, and then international members. So we have the regional and local committee that will choose the speakers from the region. Then we have from the country, and then we have a regional committee that will choose the speakers from the regions around us, the Middle East and North Africa, we call it. And then we have the international committee. With the time, the international committee developed further. So we have the World Federation with us, we have the European Society with us, we have the Australian Society with us, we have the Indian Society with us. So the choice became more open. And to be frank with you, Emirates Critical Care Conference is containing or establish the biggest network of critical care doctors and nurses in the world, not in the region. And that's a burden on how to choose, how to diagnose, recognize the speaker that gives you benefit, the speaker who can give the message to the others, and the speakers who can respond to the queries, to the interactions. And that makes us also to think about not only speaking, but also to establish the equipments, the new protocols, the new workshops, the hands-on workshops, so that companies, when they have a new machine, they want to introduce it to people. They want the people to have a hand on it, to have a hand on so that they can work properly. They understand the concept. There are so many things that makes us decide who will really give the benefit. At the other side, who will really become a speaker? When I choose a regional or local speaker, I put him on stage with one of the prominent international speakers. They get scared, they get aware or nervous, anxious. With the time, they start to learn that area. So now we have speakers from the region or from the country who are participating in international conferences everywhere in the world. We are receiving recommendations from America, from South America, from Europe, from Southeast Asia to attend this conference. ECC started alone in whole MENA region, and maybe we were the second, or maybe the second parallel to another conferences in Asia, like the Indian, like the Korean, like the Japanese. They started with us.
One of the first.
We are among the first, actually. We are among the first. There's no one first in the region. So at the moment, with the 21st century, or the 21st ECC, we are having maybe 3 to 4 conferences only in UAE. Is it competition? No, it's not at all. I am very happy that we started alone, and we have so many people are willing to really share the knowledge. And other way around, I'm not taking them as competitors. No, I'm supporting them with my experience. I'm supporting them with my speakers. I'm supporting them with my finance, with the support of the bringing the affiliation of certain societies from outside, supporting them to choose the speakers. And sometimes we speak of to our industrial partners to share in the support of all other societies. That makes us happy and proud, actually. We are the first, but we are not the only
Of course.
at the moment.
Yes. And at the same time, you've inspired so many other conferences to start
No
up.
doubt, no doubt. It's a responsibility. We have a deep feeling about it. We did not start to stay alone. I always say our motto was the West meets the East in Dubai to exchange experience. Exchange experience means we have to let the message go on. It's not fair. I learned something. I'm very good at it, and that should be only in my hand. No, it should go. The message should continue.
Yes.
Because healthcare provider, healthcare services, it's not dependent on one doctor. Maybe we have some certain figures in certain procedures, but that's not fair. If I know something, I have to teach it to everybody. I have to let the message go. One day we are no more there, so the service should not finish. Service should continue, and that will only continue if we share it, and share it with full enthusiasm, with full support, with full courage, with full love to the medicine, love to the job.
Because knowledge is supposed to be shared and not kept.
No doubt.
Yes.
That is the basic concept of human being. You see, one of the funny coincidence maybe, we are intensivists and we deal with tough diseases. So there is no joke. Patient's coming at the end.
Of course.
It's either he rolls down to the grave or rolls up back to life.
Yes.
And we have to fight. And we have to fight the disease, the complications, the multi-organ failure. That builds us inside as a tough personalities.
Of course.
That's why most of the doctors, they find us tough to be dealing with. Why? That's our personality. If we are not tough with the disease, we lose the patient. So there's no joke.
Of course.
At the other side, you find us the smoothest on the human being life. We deal very delicately, smoothly with the soft tissue. Is this soft tissue being destroyed?
Yes.
So he needs our gentleness to bring him back. And that's part of it. And I cannot keep that knowledge and that skill only in my hands or only in my brain. No, that's not enough.
Has to be
If I am tomorrow in that bed, I need somebody good as me to take care about me.
That's right. Yes.
That's why I believe that education, experience, skills should be shared.
Yes.
And that motivate me to make ECCC reach where it is reaching now.
And speaking of sharing knowledge and sharing, well, experiences and expertise between experts, what kind of topics are usually spoken about or discussed in ECC in general?
Basically, there are certain schools in the world that deals with diseases. There's the American school, and there is the Western school of Europe, and there is the low-income country school, right? So what we try to do, we collect all of these people who have special schools of dealing, special course of research, special school of development, the equipments and the concepts and the guidelines. We bring them together so that when you come and tell me this is my study, I have the right to discuss and question the way you go through the studies. We say always numbers never lie. I agree with you. 9 plus 1 or 5 plus 5, they both equal to 10. But what is your approach? 9 plus 1, that's win-lose, or 5 plus 5, that's win-win.
Yes.
Me as an intensivist, I have no chance sometimes to think of 5 plus 5. I have to be 9 plus 1. I need to win. But sometimes I need to use the 5 plus 5. I need that the patient body to win. I need me to win. I don't give chance to the disease to win.
Yes, of course.
Yeah.
Of course. Yes.
It's not only the physical part, no, it's a psychological part, of course, a very important part of our job, which I believe in, and we will never move if we don't talk together, if we don't exchange our experience, if we don't share our knowledge.
Okay. So we've discussed how the speakers are chosen, and we've discussed what do they speak about, or what they talk about, or discuss. But now we should talk about who are they talking to, what are they discussing to, and who's the target audience.
One of the ways they weigh the number of the conference, you are number one or two or three, is the number of speakers you are having,
Okay.
number of the topics you are having, number of attendees you are having, the diversity of your speeches, the diversity of the attendees.
Yes.
So we have around 300 speakers in our conference, whereas so many conferences, they have 300 as attendee. We have 300 as a speaker. So you can imagine when we have 300 number of speakers, they give me around 700 speech.
Yes.
And we are discussing around sometimes an endless number of latest studies, researches, outcomes,
Yes.
guidelines that you use to treat patients. Of course, also the way where we speak. Nowadays, we have a famous Professor Manu Malbrain in front of us. His concept was 10 years or 8 years back, fluid is everything that can solve. People laughed at him. Nowadays, Manu Malbrain is leading an international fluid academy where everybody want to tell him what you mean, because it is becoming number one concept. If you maintain good fluids, you save body.
They want to learn from them.
Yes, of course. It is always like that. The choice depends on the outcomes. The
Yes.
choice depends on the studies and guidelines and researches provided
Yes.
with a positive impact.
Yes.
The Surviving Sepsis campaign, it's a group of doctors from around the world. They used to sit together, calculate the researches, and give us a guideline. Whenever you think or suspect of sepsis, this is the line you have to go through if you want to save patients.
Yes.
They will give you a test about the patient, the possibility of the death, the possibility of recovery. So if you go through this line, you get this recovery.
Yes,
If you go
yes.
to that line,
Yes.
recovery is stopped. If you reach this level of severity, you have to change the concept from fluid to antibiotic, and so on.
Yes.
So many things that need really to be discussed professionally,
Yes. Of course.
and that is the way we know our attendee. It's not that he listened to the concept, he goes home with the message. No, he
Yes.
discuss.
Yes.
He wants to know. One of the years we have a very big discussion among the leader of the World Surviving Sepsis campaign, Professor Richard, with a small doctor. I would say not a small. He's a consultant in Thailand.
Okay.
And after the speech of Professor Richard Dillinger, he said, the Thai guy asked him, "So what is the cost of your concept?" He said, "To reach these guidelines, it cost us 10 million. And that's when the Thai man laughed. He told him, "I reached the same guideline with the cost of 1 baht. And that's the cost of paper. For you to start an AI, a computer, a
Yes.
program, a system, that's cost.
Yes.
For this guy, it's a paper and pen."
Yes.
How he reached that? It's the end result of this person who spent millions to give me a guidelines that I can make it practical by a piece of paper.
Yes.
He has the same results I have. Why? Because I'm using the same end result. I'm using the program that he gave to me, the amount of fluid I use, the time of fluid I use, the type of antibiotic I use, the time I start to interfere when there is multi-organ. It's done.
Yes.
The cost was there, but the benefit was global.
Yes.
He spent 10 millions to help me when I cannot spend more than 1 baht or $1.
Yes.
That's the concept. That's where we do the exchange and the balance, and that's where my happiness when I see that there is a big message from him
Yes.
to him,
Yes.
and the end result, both patients get the benefit. That's my happiness.
So we can generally say that the target audience for each doctor that's eager to learn more, that's eager to better serve his expertise around the world. That is our main target audience, isn't it?
I always say critical care medicine is no one-man show. Never. It's a teamwork. So I need the doctor, I need the nurse,
Yes.
and nowadays I need the technician, I need the nutritionist, I need the physiotherapist. So they all work as a team to bring back that patient who's in a severe area.
Yes.
I agree sometimes the leader who takes decisions is a doctor, but who does the job is the nurse.
Yes.
Who helps me to clean the lung is a technician, a respiratory technician, a ventilator technician. Who helps me to re-establish the power of the patient and immunity is a nutritionist. Who helped me to mobilize the patient is a physiotherapist. So these all people are targeted in my conference. It's not only the doctor. No,
Yes.
all of these people are targeted.
Yes.
The second thing, when I have a patient, they never come directly to me. They go through emergency. So I need that emergency physician to understand what does critical care mean. I need that medical doctor to understand where is the point of critical care that I need that to call the critical care doctor. Yes, we have target towards critical care healthcare providers, doctor, nurse, physician, technician, physiotherapist, nutritionist, pharmacist. But I am also directing my aim towards the emergency people,
Yes.
towards the internist people, towards the surgical.
Yes.
And nowadays, the advance in critical care made it subspecialized. Now we have the Neuro Critical Care Society in America start to establish, and we are helping them to go throughout the world. The kidney critical care, nephrocritical care, start by people in India, along with Professor Topas Kumar from India, along with Manu Malbrain from Belgium.
Yes.
And there is the concept of trauma critical care. There is the concept of surgical critical care, medical critical care. So it is expanding.
Of course. Yes.
Yes, there's no limit. However, we don't accept a patient who is having diabetic to be corrected. No, that's not my job. My job is when that diabetic patient reach a level where he loses his life, then it's my time to intervene.
I see.
And I need them to understand, call me when you cannot. And they need to come to attend and get the message.
That's how they learn.
No, it's not a matter of learning. They are very expert in their field. That's where they will know when is my need.
Oh, okay.
Let's say it like that.
Yes. Yes. Okay. So it's in a way you're communicating to them in a way.
In a way, yes, we are communicating through conferences. And as I told you, when we started 2004, we were having 300 attendees.
Yes.
And now last year we touched 2,000
Yes.
attendees.
Yeah.
A huge, for
course.
subspecialty, it's a huge number.
course.
I told you, we have 300 speakers,
Yes.
which are sometimes it's 300 total attending.
Yes.
So this transport make us grow big.
Of course.
And the Emirates Critical Care Conference in Dubai, I told you it's the third in the world. And this year we are going to bid for the 2028 World Congress. We have already gained the 2028 the nursing, and we are collaborating with the 2028 neurocritical care, and we are going to make a 2028 for sepsis care. We are going to make Dubai as really the hub that will introduce the World Federation to the Asian African region, the MENA region. We are in a globe. We are not in a place we're separated for the west or the east. No, as we said, and our motto will always stay the same. We're bringing the west with the east to meet in Dubai. Exchange your ideas, exchange your experience, learn from each other. And that's what we achieved, and that's what we have seen. And maybe you noticed today the amount of memorandums we signed with certain countries,
Yes.
and the amount that people are recommending to have these memorandum,
Yes.
and the number of societies recommending or requesting us to call them in the next conference. It's a success because of Dubai. Dubai is a hub that attracts people to be, they call it sometimes the Est country, the best, the first, the tallest, the smallest.
Yes.
So we are part of it.
Yes.
And not only it's the center of the globe, no, it's the accessibility, the availability, so many things make it a hub of attracting everything.
Yes, of course. Well, there we have it. We've spoken about the topics. We've spoken about who gives these topics and discuss them. We've spoken about who listens and receives them as target audience. Now, as closing remarks, for those who are on the fence, missed the first day, they still have 2 more days to go. why do they absolutely have to attend the next day and the day after?
Yes, that's a very good question. I like it. See, what we are doing, the group of the organizing and scientific committee, we are not doing a conference that continue itself. We are doing 3 days, three separate conferences of critical care. We have one day which is directed towards critical care in the neurosurgery or the neuroscience. If you missed it, come the second day, you will gain the knowledge. It's another conference of the same power, different ideas. You missed it, come the third day. You did not. There's still chance to learn. If you miss the third day, then you lost everything.
Yes. Hopefully you don't. Hopefully you don't miss everything.
No, according to our experience, to be frank with you, usually you have your number of records when people start registering. And what we learned, the number increase on the first day, an increase on the second day. That's why we never speak about number, how much we gain.
Yes.
And a decrease on the third day. But people who are, the critical care healthcare provider is working a shift style. So they don't, no department can close and send you 50% of its staff.
Yes.
So they have to exchange. So they have to cover each other. And they arrange their rotas in a way the full power is there provided and the full possibility to attend the conference. And we don't do it only for the local area. No, we are gaining a lot of people from the region. A lot of people applied even for the critical care nursing. We have 2 people coming from the United States as a critical care nurse to participate here. And they wanted to expose themselves to the world, asking us, do you have critical care nursing? We said, yes, we have the World Federation of Critical Care Nurses, which they didn't know. They said, can we work with you? I said, of course. You are part of the globe. You cannot participate on one condition if you are living in the moon.
Yes, exactly.
As long as you are living in the world, you are part of the West or the East.
Yes.
And Dubai is the hub. And we start to give them a plan, how we are going to plan it next year so that we can involve them here to be part of the ECC. It's not only for doctors, I said. No, we are having speakers from the nursing side. We have speakers from the nutritional side. We have speakers from the all technicians that works in a critical care, simply for all. Whoever provide healthcare in critical care, this conference is for them. And not only local, it's an international concept.
It's for everyone.
Yes, of course. Everyone in the globe, as I told you, unless the people are coming from the moon.
From the moon, exactly. Unless you're from the moon, you're welcome to join us. Today was the first day. It's taking place in the event center in Dubai Festival City. You have 2 more days to go. Hopefully, you get to meet Dr. Hussain and have this lovely discussion with him in person. Dr. Hussain, thank you so much. For this
Looking
discussion.
forward to see everybody. As I told, you didn't lose a chance. Come tomorrow. You will still learn. You will still see something new. You will lose only if you didn't come the 3 days. And if you have a reason, I do understand you. But then you have to wait 1 year until next year we come back.
Doctor, thank you so much for the discussion. It was
Shukran,
great
Jazeera.
having you.
Thank you. It was
Thank
a
you,
pleasure
Doctor.
for me to be with you. Thank you very much.
Thank
Thank
you.
you.